We are here to share with everybody, including members of the press, on IJN's achievement as the first center in Asia that adopt a system called the Affera system, Affera Prism-2 system. And this is a milestone for us to proceed with procedures that concerns patients with abnormal irregular heartbeat, or better known as atrial fibrillation. So just to give context, Affera Prism-2 is a system that was developed under the company of Medtronic, the person of which Mr. Darren is Mr. Gan as representative of the company. And this is the first system of its kind that helps a doctor who deals with atrial fibrillation the ability to give treatment to patient with atrial fibrillation, to do a procedure using a single catheter. That means you just use this particular system or this particular spore, as what Dr. Saiful is saying, use it to complete the procedure without the need for another catheter. So this is very unique in the field of electrophysiology, more so in atrial fibrillation. And atrial fibrillation, if you are unaware, is a growing epidemic, not only for Malaysia but also for the world, in which patients, as they advance in their age, develops irregular heartbeats. Before I continue, I would like to acknowledge the presence of Dr. Surinder, who is also one of the consultants in IJN, one of the electrophysiologists that works and bring the system into practice. So coming back into this, so it is an epidemic, and it is estimated that roughly about 10 to 30% of patients, as they progress in their age, will develop atrial fibrillation. So atrial fibrillation causes the heart to be beating irregularly, and this exposes the patient to risks. Some of the risks includes heart failure, strokes, difficulty in breathing, and a lot of other symptoms that, if left untreated, will make the resources of a country depleted just by the sheer number of it. In IJN, we have been treating atrial fibrillation for a long time. When the first invasive treatment of atrial fibrillation was first introduced, it was introduced in IJN. Now it has moved into the second phase, where new sources of energy is being used to ensure that the patient is not only being treated in an effective, but also in an appropriate manner. There are a few systems that are currently available in the market. Affera Prism-2 is the latest, and this is considered almost like a totally different way of treating atrial fibrillation as compared to the old way of treating atrial fibrillation, where you need to have multiple catheters to ensure that the procedure to make the atrial fibrillation or the irregular heartbeat goes back to normal, be done in a safe and sound manner. So perhaps it's better if I can illustrate this with a case that we did yesterday. You want to show the case? So we did a patient who were 60 plus years old yesterday, and this is how the the system looks. So what you are seeing now is that as the device or the catheter that is called this catheter is moved inside the heart, it begins to create the shell or the picture of how the left atrium looks like. So as it moves, it begins to collect information. The information gathered is not only in the form of how healthy the tissue of the left atrium is, but how fast the heartbeat travels through the left atrium, the chambers of the heart. The image of the purple to the left is the structure of how the heart looks like. The red is where the veins that brings the blood vessels from the lungs into the left atrium is located. The image on the right is the speed of the electrical activity as it travels through the heart. And you can see that it just flashes like that. That's basically the electrical activity of the heart. Can you stop there for a while? So if you look at this, stop the image. Yeah, okay. So if you look at this image, this is how the left atrium looks like from the inside of the heart. And that is being visualized by the Affera system, as well as the image that is constructed using this catheter that I'm holding here. Yeah. So as you move the catheter inside the heart, it touches the system. It records into the whole big supercomputer that generates the image in the form of the structure that you are seeing it now. So notice you can see a lot of colors, right? So there are colors that are red, there are colors that are purple, there are colors that are green. These are colors showing where the scars of the hearts are. So if the heart colors are purple, these are the healthy part of the heart. The colors which are red are where the scars of the hearts are. And if you look at this patient, this is where the patient developed the place or the area where atrial fibrillation sets in. If you look at the image on the right, can you play back the image, please? You see that there are areas where they are black in color, and these are areas where, because of the scars that happens within the heart, there's no electrical activity travels around it, because they are basically scar tissue. If you have a scar tissue on your body, you know that it looks different than the rest of the body. So this is how the system uses, as you can see. This is extremely very accurate, because for us to construct this, we have to have a 3D mapping system so that we can have a good image before we can deliver what we need to do for the patient, which is ablation. Okay? So can you fast forward to, now that we have the information we need, which is the diagnostic part, which is where we collect the information. The second is we need to burn those areas that are causing the problems to happen, and that's called ablation. In the old way of doing things, or the other system of doing things, we have to change the catheter. That means that we have to take that thing out and put in another catheter to deliver the energy. So you have to do or use at least 2 different catheters. With this particular system, it carries 2 significant advantages. The first advantage is that you can see the green dots that is being created. Those are the same catheter delivering energy to perform the ablation. You see that we do not change the catheter at all. We are using the same catheter. So as you are encircling the area, trying to isolate those areas that have very abnormal tissue, it jumps, is it? Yeah. Can you play it back? Yeah, you can see that we are encircling those areas where the scar tissues are present. Can you play that? And these are happening around the areas called the pulmonary veins. And as you ablate and you complete the procedure, you can see that those areas that you have marked are the areas where the ablation lesions are being delivered. Again, notice, same catheter, no need to change. So this is, in the terms of the processes, it makes the processes very efficient, because we don't have to change the catheter and expose the patient to risk. Yeah. So as you complete the process of ablation, where you get rid of all the abnormal tissue, and the processes are completed, we then remap back again. That means we create another map. And once we create another map, we can see the effect of our treatment to render those tissues homogeneous. It does not going to have so many colors after that. Can you show the image, please? Back to the voltage post-ablation. So what you are seeing now is a live case that was performed yesterday involving a patient who has a lot of rhythm problems, and we can complete that procedure in about 2 hours, which usually in a standard procedure using the standard setup will take us about 4.5 hours to 5 hours. So now if you look at this together with the lesion location, please. So remember, just now you have a lot of okay, good, all right. So remember just now when you have the first picture, remember there's a lot of pictures with a lot of different colors. Now you only have 2 colors, the red and the purple. So basically what we have done is that those areas where there are scars, we have homogenized it. So you make it into all the same colors, all the same kind of consistency, so that there are no potential abnormality or tracks or pathways that can trigger the AF episode in the future. Yeah. So as we were doing this, remember what was the first color that of ablation that we used? We actually used green. Can you go back to that green ablation? Okay, just look at the marker for the ablation. So the second unique approach for this, yeah, that one is good. So, yeah, okay, good. You see that? So that is how we tag and we do the procedure. Now you see that the colors are green, right? The greens are the area where we deliver the lesion to isolate this abnormal tissue. Why is it green? This is the second important characteristic of this catheter. The standard catheter only delivers energy to cause the ablation using radiofrequency ablation. The issue about radiofrequency ablation is that it carries with it a risk to the patient. This catheter is unique because it has 2 sources of energy: a radiofrequency energy and a pulse field energy, and it can be delivered from the same catheter. Again, another important fact is that you don't have to change your catheter, you just use the same catheter. So if you look at this patient, those are the areas that we burn on the left side. What happened next to this patient was that he had fast heartbeat originating from the right side of the heart. So we have to go to the right side of the heart, construct the right side map of the right atrium or the upper chamber of the heart, and study the abnormal electrical activity, because this time after the first procedure, the whole abnormal fast heartbeat shifted to the right side of the heart. Can we have the right-sided map, please? Can you turn it? Yeah. So again, if you look at this right side of the map, you can see that, can you show the voltage map? And play the propagation. So this is the abnormal rhythm that goes around the right side of the heart. So if you look, there is a wave that goes round and round. Remember, just now we were doing the left side. Now we are doing the right side because the abnormality has shifted from left to right. Those abnormal conduction is the abnormal rhythm that circulates on the right side of the heart. And what do? We use a different kind of energy called the pulse field. So you can see that as we deliver the energy, the catheter is going to be marked as red. So the green is for pulse field and the red is for radiofrequency. You see the colors are different? So the colors are different because it marks to us a different energy being used. So the question then becomes, why do you need different energy within the same heart? The answer to that question is, there are some energy that are going to be more dangerous to the patient, RF as compared to PF and vice versa. Therefore, the ability to choose the energy source being driven is going to add additional safety measures to the patient. So in this particular situation, we choose to use radiofrequency energy that is marked by the color red. And you can see that we completed it with this radiofrequency energy on the right, pulse field energy which is green on the left, and we completed doing the procedure on 2 chambers of this patient within less than 2 hours. So the third point of the procedure of the system is that it confers to the operator as well as to the patient efficiency, safety, then the ability to tailor the energy choose or the treatment delivered to suit the patient's need rather than to be limited by it. So coming back to the questions of training, yes, we have training. So what we did was we brought in a specialist or consultant who works in a center in Greece as well as France to come and do some cases and see us how to do the cases and give his tricks on how to handle the system. So we have a good outcome from that. The first cases were done by one of us, Dr. Surinder, Dr. Soraya, and me. And not only do we need to train the doctors, but we also need to train the support, especially the support crew, as well as the technician, on how to set up the system. So in that manner, on that point, it is important for me to acknowledge the support delivered to IJN from Medtronic, who not only arrange to fly in the doctor, but also the technical support to teach our people, as well as our local support team on how to run the system.
I'm Hani from Berita Harian. So since when the system has been launched? Is it today?
The system was launched about 2 weeks ago.
9 of February.
Huh?
9 of February.
9 of February.
9 of February. And how many patients have been treated by using the system?
We have used it on 11 patients. We are fairly choosy in choosing it because when we put up a case with a system like so, we make sure that the patient requires that system, such as like in an example like this case where you have complex multiple abnormalities, and we take our time to do it because we actually want to learn and to get familiar with the system. Having been in electrophysiology and in IJN for the last 3 decades, I can tell you that as far as usability of the system is concerned, it's very, very friendly and it's fairly easy to use and to master, especially to navigate within the chambers of the heart.
You know, why is it important to Malaysia for having this system?
Good question. There are a few reasons. Number one is that we can now tailor treatment to patients. Because as you can see, we have options on energy, we have options on delivery. Those days, we only have a particular system for all problems. Now we have a lot of system for a lot of problems. So we can actually pick and choose. And that's important because of a few aspects. Number one is that because it improves the safety and delivery of the patient, we can tailor it to the needs of the patient, and usually the outcome is going to be improved. And more importantly is that we are efficient, because if you are going to do a long procedure, the longer the procedure, the higher the risk. So this sorts of like make the whole thing efficient. We can cut down procedures in fairly short periods of time. And therefore, if you look at the risk of complications 10, 20, 30 years ago as compared to now, with these new advancements in technologies, the numbers of complications are much less.
any question regarding the patients? Once the technology is fully established in IJN, how can you determine which patients will most benefit or will undergo this system?
Yeah, so that is a clinical question. Usually we tend to want to do patients who have atrial fibrillation first, because as far as the indication for the system being used is for atrial fibrillation. There are many ways to do atrial fibrillation, but the niche for this patient would be for the complex ones. The ones that, as you can see, when you burn on the left, goes to the right, you burn on the right, it goes to the left. Multifocal, as well as patient who tends to have recurrence. That means they have a simple procedure before, and they come back to a more difficult kind of rhythm problems later. In the future, the system is also being developed to use in the lower part of the heart, which is the ventricles. That will be coming soon, probably in about a year and a half's time. And again, it's very important to us to be early on the train to master the system, because it sort of like prepares us when we go to the lower chamber, when the systems are developed for the lower chambers.
How it used? Yeah.
Dato', how about the feedback for the 11 patients that use this system?
Yeah, the 11 patients, all 11 went through the procedures very well. The procedures were done under general anesthesia. The range of time taken is between 1 hour to 2 hours for this patient. No complications, then they were actually discharged the next day after the procedure. So it's a good, safe system for the patient.
So how many of it, the system is it?
Say that again?
How many, the system?
The system consists of two things. Number one is this catheter. Catheter. Catheter is basically anything that you put inside the heart that is attached to a tube is called a catheter. Yeah. So this is the one that you see moving around the heart like so. But this has to be paired to the master system, which is the one that you're going to see outside.
How cost it? How much is it?
Of course, I'll ask the CCO to elaborate.
At the moment, we have not decided on that. All these 11 are actually
They are mixed, both
government and private patients.
I'm Thomas from Malaysia News Channel.
Right.
What are the post-treatment to patients required medications and follow-ups?
Treatments, okay. Post-treatments usually consist of two things. Number one is medication. Certain kind of medications are required to be initiated or to be stopped, depending on what is needed. And the second will be on recurrence, whether or not it comes back again. Because the issue with atrial fibrillation is that it tends to change its shape. It comes into this form, later on it comes into that form, in which treatments will depend on what kind of presentation that happens later.
Alifa from Kudlu. Just to clarify, government patients, they are paid for by the government, right?
Subsidized.
Subsidized.
Yeah.
So that's
This innovation, was it invented by Medtronic?
Maybe Medtronic wants to answer that.
Yeah, okay, so this is a company that we acquired recently. And we are really proud that we are able to bring to IJN and Malaysia, being the first in Asia. So it's a acquired technology. Yeah.
That means, do other companies have such a system?
I think we are proud that it's a first technology that's integrated between mapping and also ablation together.
So they are the first in the field to come up with this. Others are playing catch up. So I think probably by the time it comes to use, it takes about 3 to 4 years maybe. Yeah. Yes, yes.
Given that this is a new technology and you're already tested on different patients, how did you ensure the safety measures of using this advanced technology? What safety measures were ensured during the procedures?
So the safety measures for the procedures remains the same. For this procedure as compared to the other AF ablation procedures that we use. The difference is in the setup, because the machine requires a different setup, but safety-wise is the same.
And who's not suitable to use such a system?
Good question. The system per se can be used for all kind of AF. So I mean that's the general rule. The technicalities for using this procedure is probably a bit more than the other ones, because the other ones is what we call as the single shot procedures. Single shot procedures, they basically means that you just go in, stuff it, and that's it. This one needs a bit more manipulation, and that's where the experience comes in. So if in a patient that is not going to be suitable, I think there's probably none as far as atrial is concerned. The only thing that I can think of that it may not be so suitable if that patient has a previous surgery that requires the implantation of a valve. That means you have a mitral valve surgery where the valve is replaced by metal. Probably is not a good patient to do because it causes a lot of interaction with the valve and the electrical system delivered.
Does the system uses AI and probably some robotics?
So that is going to be in version 3 plus maybe, because people are actually working for it. So once the people starts figuring out the AI part of it, I probably do not have a job.
How many patients do you see with this condition in IJN, and how many of that is suitable for this technology?
So we see a lot of AI. If you're just going to say about AF, the numbers people often quoted is that as you get older, you get more. We see it across all genres of cardiology. We see AF in heart failure, we see AF in pediatric patients, we see AF post-surgery. So the number, if you're going to quantify, is going to be a lot. It's just that how to approach it, because procedure is one, there are also patients that are not suitable for procedure. So those kind of numbers are quite difficult to quote. The one that I quote, the number of 10-15% as they progress with age, usually are in patients who have atrial fibrillation in the absence of any structural heart problem, meaning that they have atrial fibrillation alone without any surgery, any heart failure, or anything of that sort. But if you were to combine those numbers, it gets very high.
Okay, thank you.
So the past year, how many of this atrial fibrillation case procedure?
The ablation? I think roughly about 400 plus, 400 to 500, easily that we have done.
Besides this latest technology, currently IJN using how many kind of systems to treat this AB case?
So we are privileged to have all the systems available. So we have 3 systems, this is our 3rd. You may be invited for the 4th one in a couple of months' time. Again, it has its own sets of issues and its own sets of capabilities. But in an institution like IJN, to be exposed to this cutting-edge technology is extremely important, because we act almost like a shift, because it comes to us first, and people then comes to us and train, and they sort of like bring it up to their system. So at least we have 3 now, and probably we have the 4th one soon. And this is actually, again, being offered to IJN to be the first center to do, because we have fairly good experience in dealing with procedural AF in this region.
Thank you.
Wave. This is the electrical activity as it traverses from the right to the left actively. So this is how your heart looks like. So
so